Hello, I'm Dr. Carley from American International College, the School of Health Sciences. I teach in the Doctorate of Physical Therapy program, and we have been exploring, researching the use of wearable technology and see if we can improve not only the way we actually possibly work with patients, but also how do we train our future physical therapists and other healthcare professionals so they can engage the healthcare environment on a more contemporary level. We started with wearable technologies, but now with virtual reality, we wanted to see if we can combine those so that we can actually start to use it for both teaching and then possible clinical applications. Now with the introduction of VR Health, we can actually start to do that. VR Health actually helped us bridge that to bring us into the future much sooner than we thought was possible. So we are engaging the possibility of using virtual reality and possibly wearable technology. So we can train our students not for the past, but actually for applications for patient interaction for the future. Our purpose here at AIC is really to prepare the student for things that they're going to be involved in. And that is the engagement and the embracing of technology in the treatment and the advancing of healthcare in the future. So their patients actually will improve, we hope, on a more objective and realistic basis rather than just trying to guess. We can hopefully improve the efficiency of healthcare and patient outcomes on a more objective basis. So this is why we went with VR Health. VR Health allows us to do this, and I can explain that when we get into the program. To give you an example, we can see here when we get into the application, we can see that we can list our patient right there starting off, and we have the ability to introduce a new patient, or we can actually go back to an existing patient. We go to, let's say, an existing patient that actually was examined. We can actually come down and right there. And then if we start to look at the ability of the VR Health to capture ranges of motion in a very discrete and objective way, probably a lot better than we can with just the old techniques of trying to align the goniometry. This actually allows us to have much better inter-rater reliability and even better intra-rater reliability for clinicians. That's one thing we'd like to explore. But it seems pretty obvious to us that that is an opportunity that this offers right off the bat. The other thing that is really interesting is that it allows us to expand progress, or maybe if we thought the exercise program was working or we chose the right one, we should be able to see improvements. But the VR Health actually allows us to really look at ourselves from a clinician standpoint to say, are we doing the right thing or do we have to modify things? So here is just a pure example of that opportunity to really assess what we're doing. And so we can compare that even within that same treatment day, or maybe week to week, or even month to month. This actually helps us when we start to explain the need to continue different therapies on an objective basis to those people that are paying, the third-party payers, and typically. So the interaction is really unique, and I did have the opportunity to try this out on some of the physical therapy students and get their feedback. So you can see how it really causes them. Look at the shoulder motions that he's doing. And what's really interesting is that you find, like, he's okay over here, so I want to set the program more over here. And so you can redirect that. And you can see how much effort they're putting in. Whereas if we're going, okay, do this 10 times, you know, the patient gets bored, we get bored, nothing really happens. But this, they're working like crazy.